So this morning is a special morning. We have Dr. Ed Livingston with us, who participated in our Works in Progress yesterday and will be helping to conduct a writing workshop shortly after Grand Rounds this morning. Dr. Livingston is a native of California, born and raised in Los Angeles, went to medical school, did his residency, and had his first faculty position at the University of California in Los Angeles. There he was a GI surgeon and started the bariatric program. He was then recruited to UT Southwestern as chief of gastrointestinal and endocrine surgery, and also eventually became the chair of biomedical engineering. So a very diverse talent set. But I always had a passion for writing and scholarship and was associate editor for JAMA. And in 2012, he was recruited full-time to the journal as the deputy editor for clinical content and has been serving in that capacity for over the last 5 years. In that role, he's really elevated surgical science as well, and has worked with a lot of surgeons to get their work published in this important journal. And he's passionate about writing, about scientific writing, and he's this morning going to share with us in Grand Rounds some of his thoughts on how to write and how to write effectively, and then more importantly, we'll be leading our workshop out at Arostradero following this. So please help me welcome Dr. Livingston to Stanford.
Thank you, Mary. I've known Mary a long time, and there's lots of old friends in the room and old residents who are now senior faculty, division chiefs and whatnot, so it's, along with the gray hair, it's just time goes by. I want to talk to you about the act of writing, and I put this talk together after working at JAMA for several years because I learned that many prominent academic clinicians don't write particularly well. And that's a problem because those who don't write well or don't get help really aren't particularly effective in what they're trying to accomplish. And then there's also some who are not particularly good investigators who write extremely well, who are very influential. So the ability to write is really important if you're going to be successful in anything that we do in academic surgery. So writing is fundamentally an act of thinking, so that when you're going to write something, you have to sit down, think about what your message is going to be, organize those thoughts into your head, and then you begin writing. And there's a lot of ways to organize your thoughts. There are people who say you should do outlines and all that kind of stuff. I personally don't do that. But whatever it is, you somehow have to organize the message in your head of what you're going to say. Another very important part that I learned this from one of my mentors who was a professor at Caltech when I was in the lab, is to find your rhythm. And I didn't really get this until he explained it to me, but everybody is on a different rhythm. So my particular rhythm is that I can't think very well in the early morning. So that's when I reject papers. I get about 10 papers a day to look at it at JAMA. So when I'm not really, so it's unfortunate for you all who send us papers when I'm really fuzzy-headed, working on the first Starbucks of the day. That's when the rejections start. And then as I get a little bit more clear as the day goes on, then I can take the ones that I think that I really need to pay attention to and work on them. And then my zone is like at, between 3 in the afternoon and midnight, and that's when I'm the very best. And beyond that, I don't do very well. Everybody has their own rhythm, and so you have to figure out what works for you and then make your life work around that particular rhythm. And some of the mechanics of writing that you need to pay attention to is how you use language, and that can be very important, and that's something people don't necessarily do very well. A lot of these things come from sort of writing workshops, writing guides, and all that kind of stuff, and some of this is fairly typical for any of you who've gone through these kinds of exercises. But you should always try to avoid the passive voice, which occurs a lot in the medical literature. It's awful literature. You should always try to use active voices. And I'm going to emphasize precise language because we're really into that at JAMA. So your language should be very precise, avoid adverbs, adjectives, and qualifiers. The writing itself has to have a rhythm. So you have to think about the cadence of how somebody who's reading your writing is going to interpret that in their head, and how is it going to flow in their head. This is a little bit advanced. This is a little tricky, but if you read the truly great writers, and I have examples at the end of the slide set, and I'm not going to show them, and anyone who wants these slides can have them, of cadence in certain people's writing, and how it's almost poetic and really good writing, and you have to think about how the words flow, how the phrases flow as people read them. Now this sounds odd for medical literature because it tends to be very formulaic. And we get an awful lot of papers that are formulaic, and we do our very best to change that and to make them into a better read. And the journals that read the best, because they have staffs that do this, are Lancet, New England, and JAMA. Most other journals don't have the resources to do it. But you have to think about your writing, even scientific writing, as literature and how it can be interesting to the people who read it. And just in terms of examples of authors, my favorite author of all time is a guy by the name of Fouad Ajami, who was here at the Hoover Institute at the end of his life. And his writing is poetic. He wrote about politics, and he was just this incredible, and he has this amazing cadence to his writing that you can follow. There are patterns of syllables, short syllables followed by long syllables, but words with lots of syllables, short, long, short, long. It's a very interesting read. And in terms of keeping a reader interested as they go through the piece, probably the best at that is Malcolm Gladwell, and you've probably all read his stuff. Kurt Vonnegut had some, at the end of his life, he wrote down what he thought was important that writers should consider when they're writing novels. But there's some aspects of this which are applicable to medical writing. Use the time of a total stranger in such a way that he or she will not feel the time was wasted. The point of that is if someone is reading your paper, you should think about every single sentence and ask, am I wasting my reader's time? It's incredible how many sentences are not necessary in research manuscripts that we get. When I edit a paper for the journal, I look at every single sentence as an isolated entity. So I'll read a sentence, think about how I can change it, and then move on to the next one. We just don't slide through it. So you have to say, is this sentence important? Is this information useful to the reader? If it's not, then it goes. If it's not structured in an interesting way, then we change the wording of the sentence. At the journal, we pretty much rewrite everything that gets published. And he says every sentence must do one of two things: reveal the character, advance the action. If you were to translate that to medical writing, is this sentence leading you to the point of your paper? If it's not moving the reader into the direction of the message that you want to make, then don't have it. And we'll have examples of that in a minute. And then this one, write to please just one person. So think about your reader as you're writing your piece. Who is your audience? Are you writing for bariatric surgeons? Are you writing for general internists? Are you writing for lay people? And as you think about that, look at every individual sentence and ask yourself, is this sentence going to appeal to that particular audience? Is these sentences combined into a paragraph? Are those sentences is that paragraph going to appeal to that particular audience? You have to keep your reader in mind as you're putting these things together. And the most important sentence is the lead, and I'm going to spend a little bit of time on this. So the lead sentence in journalism is the first sentence of an article, the first one or two sentences. So an example lead here, this comes from a journalism text. I've often wondered what goes into a hot dog. Now I know, and I wish I didn't. Now the point of that is you read that and think, do I want to read this? Do I want to learn about hot dogs or not? And this sentence tells you probably want to know what you're putting into your mouth, so you're going to read it. The point of the lead sentence is you want to draw your readers into the piece that you're writing. And that's really, really important because in these days, people have way too much to read. We do surveys of physicians and readers, and especially young readers, to find out what it is that they want, what is it that they're interested in, and what they want from us. And one of the things that's very apparent when we talk to young people is that there's an unbelievable amount of information overload. They're bombarded with information. Everybody's getting emails, everybody gets internet access, there's all kinds of things coming at you. And they have to sort through that, and they have to decide of all the things that are available to them what it is that they're going to read. And that makes that lead sentence more important than it ever was, because if with all this that's coming their way and an inherently shorter attention span, if you don't capture their attention in the first sentence or two, they're gone. And so you need to be very, very careful about how you start any piece that you write to make sure that it's appealing to them. So this is one from Fao to JAMA. This is a lead sentence or two in a piece that he wrote in, I think, the Wall Street Journal in 2011. You can read it. Chaos erupted into the Arab Labs. You read this. Again, this is cadence. It's poetic. The word structure is just amazing. But why would you read the rest of this article? And it tells you in the first two sentences, chaos, regime change, young people are uprising, are we going to be next? You know, these are the things you read this one sentence and say, yeah, I want to read the rest of this piece. Similarly, the last paragraph and the last sentence are as important as the first. A lot of people will read the first few sentences and jump right to the conclusion of your paper, and they'll only read the conclusion. So your message has to be embodied in the conclusion itself. So you have to be very careful about that. So this is from that Ajami piece. I love this is why I have it. The best day after a bad emperor is the first. Having worked for some bad chairs of surgery, I can tell you, the best day after some of those guys left was the best day was their day after they were gone. And that gets somebody's attention. It's like, wow, what a great statement. And then the final message of this piece is turmoil and risk may result in better conditions. And so you read that and you really understand the message of everything that he tried to craft, the message he was crafting for you in this whole piece. So the last sentence is important. I can tell you when we review articles for the journal, we look at the abstract, tables, and figures in that order. If the abstract is no good, we won't get to the tables and figures. So we get 7,000 papers a year. We publish about 200. So that's a pretty low acceptance rate. So it doesn't take much to get rejected by JAMA, as many of you know. So we look at the abstract, and the abstract has to clearly convey the message. So you have to make sure your abstract, it's like the specific aims page of a grant. It has to be perfect. And then if we get past the abstract, we'll look at tables and figures, and they have to be good. And then I look at the conclusion paragraph next. So that's the order I go into. I don't even bother with the introduction, methods, results, none of that stuff, discussion. Abstract, tables, figures, and then the conclusion. And those things have to, if I can't figure out what's going on with the paper and it captures my interest, then I won't pursue that paper. So when you're writing papers, because that's the way the average reader evaluates, or the average reader looks at things, then you need to make sure that those components of your paper are absolutely perfect and you spend the most amount of time crafting those and making sure that they're perfect. So I want to show you examples of an example of what I think is really an awful introduction in an article that's published in a journal and take you through the evolution of it. So the first paragraph of this introduction says the World Health Organization estimates that there's 500 million obese patients, blah. You read this first paragraph and you say, okay, this is a paper about obesity and its comorbidities and something about VTE. It's 71 words to tell you that. The next paragraph is 96 words, and after you read it, you ask is it about different bariatric operations or how many are done? A different concept than the first paragraph. And you move on to the third paragraph, which is 193 words. And if you notice, I'm focusing on numbers of words. We're really into that in journal publishing. Space is a premium. We count words. When we tell you a piece has to have 1,400 words, don't send it to me with 2,100. It needs to be 1,400. We have our reasons for that. So 193 words. Now the third paragraph. What's this paper about? Well, VTE and bariatric surgery. We come back to a concept introduced in the first paragraph and how to prevent it. So we're kind of winding our way through bariatric surgery, figuring out, something is going to be done in this particular research. And then the fourth paragraph is 196 words. That's pretty hefty. And is it about how surgeons are trying to prevent VTE? So then you get to the fifth and final paragraph, a nice little 48-worder. And it turns out it's about using IV filters to prevent VTE and bariatric surgery. So with hundreds of words above it, you don't ever get to this particular point until the fifth and final paragraph that tells you that this particular paper is going to be telling you about this subject. So they took 589 words to do this. I can tell you that I have another talk on how to structure a paper. Basically, our recommendation for introduction is 350 words in 3 paragraphs. So 589 is pretty long. So what were the things that they talked about that are completely irrelevant to the paper? The prevalence of obesity, the adverse effects of obesity, different modalities of VTE prophylaxis, the relationship between BMI and VTE, and types of bariatric operations. All that stuff is covered in the introduction and never discussed in the paper itself. So getting back to what I was saying earlier from Vonnegut, don't waste people's time with your writing. Take all those things out that have nothing to do with the subject at hand. Nobody wants to read that. Nobody is going to read that. And if you take those things out, your paper will become more efficient and more appealing to the readers. So think, again, if you were to go through those 5 paragraphs, you'd say, does this sentence lead me to the issue of VTE prophylaxis in bariatric, or the use of IVC filters in bariatric surgery? And if it doesn't, get rid of it. So if I were editing this, I would have taken out the first and second paragraphs, that took out 150 words right there, and start with paragraph 3. And then the first, and in your introduction should always have a general discussion of the topic. Then the second paragraph has a more specific discussion of the topic at hand, and the third paragraph states exactly what you're going to do and really should have the word hypothesis in it. Once you have laid a stake, put a stake in the ground and said, this is my hypothesis, the rest of your work follows from that hypothesis. So you really are better off to specifically say hypothesis. Now, writing, just like in journalism, any kind of writing should cover who, what, where, when, why, and how. Now, it seems silly because that's a journalism, but if you think about who, what, why, where, whatever, in your research papers, then your message will be more coherent to the reader because they're in their head asking these things. So if I was looking at that particular paper, who, bariatric patients, I get that. What, the role of IVC filters in preventing VTE after bariatric procedures, that should have been the lead sentence, right? That's what should draw the reader in. That's what this paper is all about. So the lead sentence should have been pointing in that direction. That's the what. By the way, for those of you who are going to be with me later in the day as I comment on the one paper that was sent to me and maybe some others, it's going to be done in this framework. And the one paper that you sent me, by the way, the what is a question mark. So, what? So the exercise is useful because I don't know what this is about. So you need to go through this exercise. Where, the hospital, when, after surgery, why, whatever. But if you go through this, you'll find, if you find something that you read the piece and you can't answer one of these questions, then there's a huge deficiency and you're going to lose readers. So here's something that I wrote so I can trump my own writing, but here's a lead sentence for something I published in JAMA actually. Although bariatric surgery is commonly performed, it is not universally accepted as an obesity treatment. Now why is that supposed to get people's attention? Well, if you're a bariatric surgeon, then it's heretical thinking. What do you mean bariatric surgery is not universally accepted? Of course it is. It gets their attention. Or if you really hate bariatric surgery, yeah, I've had so many patients with crappy outcomes. You bet I'm going to read this to try to understand more about what's bad about bariatric surgery. So this lead sentence should appeal to both types of audiences, those who are agreeable and not agreeable with the concept, and draw them into the piece. At least that's what I was thinking when I wrote it. The second paragraph of that particular piece, the first paragraph was just like, there's bariatric surgery, we don't really know about the outcomes. Note here that I didn't include in this paragraph the incidence of obesity, how many people are obese in the United States or the world, and the rising increase in the obesity incidence. Probably 90% or more of bariatric surgery papers that I read start with those facts stated in the first few sentences of the introduction, 90%. Now, why would you start the introduction of a paper with facts that everybody already knows? It's just because people don't have any better ideas, so they just do that. But I can tell you, go back and look at the literature, you'll see that so many papers start with the first few, those critical sentences, saying something everybody already knows. And you need to avoid that. So you can see in this sentence, I avoided that on purpose, and I don't have any of those statistics in there, because everybody knows all these issues, so I don't do that. And when I edit papers for the journal, we pretty much take those things out. The second paragraph of this introduction is that there's major limitations in long-term outcomes and studies with a high degree of follow-up. So that there are real problems in the literature in terms of there's thousands of papers published, but many of them don't have adequate follow-up of their cohorts and limit their conclusions. And so the third paragraph explains, this doesn't have a hypothesis, but it says exactly what we did in 211 words for the whole introduction. We did a systematic review to look at high reliability long-term outcomes. So in 211 words, we communicated this entire message, and that's how we do it. The last paragraph from the sample article is really long. And why would I read this? If you look at the first part, they're talking about things that have nothing to do with the paper, nothing to do, oh yeah, I'm sorry. What it says is, published data reporting the safety and efficacy of IV filter use in the bariatric patients is heterogeneous, lack of randomized controlled trials given the shift towards laparoscopic surgery and ongoing developments. Current evidence may not be directly applicable to modern bariatric surgery. Why read it, right? If you're summarizing literature that's no longer relevant, why even look at it? So the first two lines of this conclusion says, I shouldn't pay any attention to this paper. They told you that. Don't pay attention to what we just did. So be careful about that. And that there's too much information in this particular last paragraph, the key last paragraph, that's not directly relevant to the conclusion of the study. And then this is how we did our paragraphs, just an example. Moving on back to precise language. So here's another one that I was editing last night. This is flipping gears here, shifting gears. These taxes are seen as viable policy tools. Do you see a policy? This is, again, I bring this up because in our heads at the journal, this is exactly what we do when we edit papers. We look at the words in each sentence, and in this sentence, do you see policy, or is a policy perceived by policymakers or the people who are considering? It's perceived, not seen. This is the kind of wording change that we make at the journal when we think about how each individual sentence is structured. And you should do that too. It's just, if you're using these particular descriptive words, are they really describing the process? So when they say, one of the things that drives me nuts is, this article concluded, right? The article doesn't conclude anything, the authors conclude. So the authors of the article may have concluded something based on their analysis, but the article itself doesn't conclude anything. So think about that. Another technique to make your writing more readable by readers is to use simple words. So if you have a multi-syllabic word and you can replace it with a word with fewer syllables, do that. Assistance should be help. Numerous, many. Individual, man or woman. So you want to avoid long words. Seems silly, but the writing can be much smoother if you get rid of all these syllables. And also there are the clutter, which is just lots and lots of words to describe something that can be replaced with one word. With the possible exception of is except. Due to the fact that, I hate that one, due to the fact that is because, right? So I have, at the end of this talk, you can have these slides, lists of these things. And we have a book that we published, AMA Manual of Style, and there's other books on writing that have lists of replaceable words. But think about, when you're, again, looking at your sentences, sentence by sentence, can I get rid of a string of words with something simpler, or can I take long words and replace them with shorter ones? That will make your writing better just by itself. This is the most useful technique to make your writing better. Just look at every sentence that has the word that, or there is, there are, there was, there were, and ask yourself, can I get rid of it? Now there's nothing wrong with the word that. But if you can get rid of it, your sentence structure will be better and easier to read. It's just a technique that writers use, because we tend to use that a lot, that. So here's one that I think is better by looking at. There were 849 patients excluded from the trial because they did not meet the study's inclusion criteria. Now another thing that I do when I'm looking at sentences is ask, are the first few words of that sentence telling me where I'm going with the rest of the sentence? And if you start with that, you violate that particular idea, because that, it's a very nondescript, non-precise term. What's that? So it's not until I get to there were 849 patients that I begin to understand what the sentence is about. So the way that you get rid of the that's or the there's is flip the sentence around. Take the back end of the sentence and put it first. It's a really simple thing to do, and say, if I start with the end, will it become a better sentence? And so whenever you have a crummy sentence, that's the first thing that you do. Just take the end, put it at the beginning, right? So because they did not meet the study's inclusion criteria, 849 patients were excluded from the trial. In my opinion, that reads better, and that you've gotten rid of a word. And when you're trying to get rid of words in manuscripts, every word counts. So that's something you can do, is just flip the sentences around, and usually they're better. If you're looking at it, it's not making sense. Going back to precision, get word changes to make things more precise. The procedure, what procedure you're talking about. In this particular article, they're talking about gatekeeping. So use a more precise term. Taking someone else's food might create a response. So you're not creating the response, you're resulting in a response. The food might result in a response. It doesn't cause the response. When you're writing, every successive draft should be 10% words shorter than the one before it. And if you have that goal in mind, your writing will also get better. So if you have a draft of something that's 1,000 words, the next one should be 900. And the next one after that should be 800, and then 700, so on and so forth. The reason that you do that is that people tend to get lost in their writing and they go way too long. So I just went through this last night. Somebody called me, said, I wrote this editorial for you, and I'm really sorry, it's 200 words too long. We told them you've got 1,500 words. He came in with 1,700. We're like, okay, fine. It took about a millisecond for us to take 200 words out. So, there's all this stuff, we don't need it, boom, 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 it's gone. And it's better because you take those 200 words out. So what this exercise does is it makes you be more efficient in your writing. It makes you pay more attention to what's going on. So if you say, I got to get rid of 10% of my words, then you're going to look at every sentence and say, like that one before where I got rid of one word. It's only one word, but if you do that 10 times, it's 10 words, and so on and so forth. So you should always try to make each draft shorter and more efficient in the writing. Or as I was saying earlier, there may be entire segments of something, like the one that we took out 200 words. This guy has sort of like a cutesy analogy. And it's like, okay, it's a cutesy analogy, but it's not important. You don't need it. Boom, it's gone. Now the thing's down to 1,500 words. One of the other great things in writing is Orwell's 6 writing tips. This is a good thing to keep in mind. Never use metaphor, similes, or figure of speech if you can avoid it. In our terminology, don't use jargon. Jargon is deadly in medical writing. Try to avoid it. Never use a long word when a short one will do. If it's possible to cut a word, cut it out. Never use the passive voice when you can use the active. This is really, really important. Bad writing is characterized by the passive voice. Never use a foreign phrase or scientific word or jargon if you can think of an equivalent, and break the rules if you have to. So in terms of writing, just write. Just sit down and do it. When you have an idea of something that you want to write, just sit down and do it. The hardest thing and I do this, I have to write podcasts. I write a script every week. And the hardest part of that is starting, right? You have a blank piece of paper. And in podcasts, medical podcasts, you can't start the first sentence with, it was a dark and stormy night, right? So you have to sit there and say, what am I going to say? How am I going to say it? What's the message? It's really, really hard. So that blank page effect is really very difficult. But what you have to do is just do it. Just sit down and write something, recognizing that you will never show that to another human being, and that you write it. The next day you look at it and say, oh my God, I can't believe I wrote this. Was I drunk when I did this? It was awful. And then you rewrite it again, and then each successive draft gets better. But you just have to do it. If you want to be a good writer, you have to write all the time. So I got to the point where I am because I wrote all the time. So when I was a resident on call, and I was waiting for cases to be done in OR, trauma was especially notorious at UCLA. You spent all your time in trauma. You actually didn't do trauma at UCLA. You spent time waiting for things to happen. And I kept a little primitive laptop in the 1980s, and I just wrote all the time. I wrote and wrote and wrote and wrote. My writing was awful. My wife will tell you it was terrible. But eventually you figure it out. If you read writers like Gladwell or Atul Gawande or any of them, they will all tell you they were terrible when they started. Gladwell has a podcast on this, which is fascinating. He'll tell you, I could not write worth a damn. And it took him more than 10 years just to get to the beginnings of being able to write coherently. And he worked really, really hard to improve his skills. He was not a natural writer. And now he's one of the greatest storytellers ever. But it was a learned skill for him. And I can tell you from my own experience, and now I'm an editor at a big journal, I was not very good at this when I started. And so you have to just keep writing, just keep doing it. You will eventually get better. It's like anything else. And as I mentioned, do the abstract and tables first and all that kind of stuff. But anyway, just write. Just do it over just as much as you can. I mentioned earlier that we talk to young readers. And when we first did this in 2014, I was really stunned because I sat down with a bunch of medical students. And I said, what textbooks do you read? And they said, textbooks? We don't use textbooks. And I asked them, so like if you need to look something up, where do you get it? And they said, what do you think? Wikipedia. I asked practicing physicians, where do you get your information? Wikipedia. And if not Wikipedia, up to date. That's what they do. Textbooks are gone. When I talk to them about long reviews, these authoritative reviews, we do, New England, other journals do, they tell me who has time for that? They don't read it. So one of the things that we did in response to this survey is we pivoted to short articles. So all the new articles that I've developed for the journal in the last several years have been 2 pages. If you can't summarize things in 2 pages, most people are not going to read it. So one of the things about the modern reader is that you have to be extremely efficient and your piece has to be short. Nobody wants to read long things anymore. And also they told us back then that they wanted everything in audio. To a person, at the time we were doing the survey, the podcast Serial was out. Have many of you heard that? Every single person at the time was listening to this and they said, you need to present your information like the podcast Serial. Believe me, that was a tall order. We did another survey this year and asked them specifically, these are all medical students, they all are members of the student AMA, there's 60,000 of them. We asked them, do you read our journals which you get for free? And the response was a disheartening, no, we don't read journals. I said, why not? They said, who has time for this? We don't have time to read. We're too busy. How do you want your information? We want podcasts. We want to be able to absorb this information when we're riding our bike, when we're on the train, when we're on the treadmill, whatever. So I want to speak to you about podcasting for a minute because we pivoted in a major way towards podcasting because of this. That's where the young people are at. And writing for podcasting, writing for audio is a completely different skill. So I did this about 2.5 years ago. I started the JAMA Clinical Reviews podcast, which it took me like a year just to figure out how to write a script, how to voice it, and all that kind of stuff. To give you an idea of the uptake of all the things that we have going on at the journal, the fastest growth has been in the podcast sector. So 2 years ago, we had 350,000 downloads of our portfolio of podcasts. This year, we're going to have 2.5 million. And of this one podcast, JAMA Clinical Reviews, there will be 1 million downloads. It's growing like wildfire. So if you're going to communicate with people these days, you need to think about audio and podcasting. So when you're doing a podcast, you have to have an idea, figure out what story you want to tell, and I encourage you to think in terms of stories. Even though you're going to talk about hypertension, so today at 10 o'clock Central Time, which is 8 o'clock, I guess, soon, I'm publishing 2 podcasts, one on hypertension. Trust me, it was a real challenge to think of something interesting to tell a story about the new hypertension guideline from the ACC-AHA. There's not much of a story in that, so I tried. I can listen to it, see if you think it's interesting or not. We got, start out with FDR and his famous infamy speech and all that stuff. Well, he died of hypertension. So there's a whole story about him and hypertension. So we tried to make it interesting and tell some story that draws people into it. When you're doing a podcast, you're going to interview people, get transcripts of those interviews. I've tried all kinds of things, and all the podcasters tell you go from transcripts. Believe me, you need transcripts if you're going to produce audios. If you do an interview, get a transcript made. Then you write a script. Then you do voiceovers, and then you review your rough cut and finish it off. Just like with papers, the title has to be very interesting. So the crowd that listens to podcasts are younger than those people who read, and the titles are even more important. If you don't capture their imagination in the blink of an eye, you'll lose them. So the title has to be crafted very carefully, and the show notes for podcasts also have to be crafted carefully. So one of the things that we learned is that when you're looking at like iTunes or something, you only see the first couple of sentences of the show notes, and if every one of your shows says, this week, Dr. Livingston interviewed ... that's all they see, they're going to say, who cares about Livingston and who he interviewed? But if you start off with like, new opioid guidelines were released by the CDC, they'll say, oh, okay, this is about the new opioid guidelines. They decide if they want to listen to it or not. So be very careful about what people are actually seeing when they're scanning the landscape looking for something to listen to. Just like with writing the first minute of your podcast, we actually know when people drop out when they're listening to our podcasts. And if you don't capture them in the first minute, they are gone. So the first minute of that podcast has to be very carefully crafted with the thought of how do I get them to listen to the rest of this. And another thing about writing for audio, it's a very different skill because when you read, if you miss something, you can go back and pick it up. You can't do that in audio. So if there's some critical fact that's important for you telling your story, and the reader, the listener just blanks out in that fact, and they can't follow the rest of the podcast, you'll lose them. So when you have some important message that's wrapped around a single fact, you need to subtly repeat that over and over again in the podcast so that they'll get the message. So when you're writing for audio, you have to think about how people are listening to you and how they pay attention to, and the fact that they will quit paying attention at various times during the podcast. So you have to write with that in mind, and it's a very, very different style of writing. Really, really hard. Telling a story is really, really hard. I just mentioned hypertension, and the same deal, the what, why, where, how, and when. When you're putting podcasts together, try to avoid having anybody speak for more than 2 minutes. That's kind of the rule of thumb in the business, 1 to 2 minutes. Anything longer than 2 minutes and you lose people. And when you're interviewing someone and you're playing the audio from the person that you've interviewed, rarely do the people you interview have any experience with audio production or audio recording, and they drone on and on and on and on. So anything that's more than 2 minutes of an untrained speaker is deadly. So you usually want to use clips of 1 or 2 minutes. The exception to this, who knows who Tom Naska is? You've all got to know, right? He's the head of the ACGME, right? He's the guy who did Claire, all that stuff. That's him. I sat down to interview him in his office. I was setting all my stuff up. And he said, you know, I was a radio announcer in college. I'm like, you're kidding. And he was the best interviewee ever because he knew how to talk. So, but most people don't know how to do that. So to get around that, you have multiple people, alternate voices, all that kind of stuff. Music is key. Music actually is very, very important in getting people to pay attention. It can actually help determine the flow. It can highlight things. So getting a producer who knows how to use music is very, very important. And you want to intersperse sound or alternate voices to keep them engaged. Recognize that they're going to get bored, they're going to drift off, and you're going to have to keep them engaged. Now voicing and voiceovers. Now this took me a long time to figure out. And with the help of a very experienced producer who would sit there and say, oh, you inflected your voice wrong. I'm like, what are you talking about? I'm just talking. He said, no, you need to have your voice go down at the end of a sentence. Like, what are you talking about? But so you have to think about that. And so there's a lot of medical podcasts out there. A lot of them are just deadly boring, and it's somebody just talking into a microphone. If you've ever had the occasion to talk to reporters, and some of you might have, when you talk to a reporter, you hear a very different voice than when they go on the air. They have an on-air voice, and that's sing-songy, and it emphasizes certain words and all that kind of stuff. And when you talk to them, they're just talking like anybody else. That voicing and how you use your voice and how you emphasize certain words becomes critically important when you're producing audio for podcasts. And how your intonation goes and whether you go up or down is also really important for how you bring your listener through your story. And you have to really pay attention to that. And just like writing, it takes an enormous amount of practice. Like you do it, you listen to it, and you think, oh my God, that was awful. And then you do it again with a different kind of voicing. I'm fortunate that I have these producers who'll sit with me in the studio and say, oh, you said that wrong. You use your voice this way or that way or whatever. You can take, and I've now had some experience with this, you can take stuff written just for writing, which is a different writing style, not written for audio. And just by using your voice, going up and down, or emphasize a word, then that will actually make it so much more coherent to the listener that they'll say, hey, I can understand what this person's trying to talk, as opposed to when you just listen to somebody who's reading something. Just reading something in audio is just deadly. It's very important to have good audio quality. There's a lot of good podcasts that are marred by the fact that the audio quality itself is terrible. It's not that expensive to get into the business these days. For a few $1,000s, you can have really high quality stuff. I'll be interviewing some patients later in the day for podcasts that we may develop from here. My portable stuff costs less than $1,000, and the quality is amazing of what we can do. These are some resources for writing. These are things that that I've read that I think are really helpful. The AMA manual style has lots of these little rules about how you do things. And some of the better sources for how to write come from Robert Knight, Stephen King, George Orwell. My favorite is actually Stephen King's. He has a book, it's titled his memoir. The first part of the book is his memoir. The second part is on how to write. And it's actually probably one of the best guides of anything I've ever read in terms of how to actually write something. And anyway, so these are the resources. There's a bunch of slides after this which are very technical, which are lists of word changes and all that kind of stuff. I welcome you to the slide set. You can use them, play with them, throw them away, whatever. But, so there you have it. Go and write, go and do podcasts, and I'll be happy to entertain any questions. Thank you very much.